I'm extremely excited to have you here with me. Today I'll be your host on Just Kids Health, where we give healthy tips for growing kids. I'm very proud to be interviewing our amazing guest who will be showing you info of COVID-19. Ladies and gentlemen, big and small, please welcome my doctor and friends, Professor Dr. Michael Steven Timms Ent Specialist. Doctor, can you please introduce yourself?
My name's Michael Timms. I'm an ear, nose and throat surgeon. I'm British. I was trained in Leeds in the north of England and did my surgical training across the Pennines in Manchester and worked as a consultant in the north of England for 20 years before coming to the Middle East. My qualifications are Bachelor of Medicine, Bachelor of Surgery from Leeds, Fellow of the Royal College of Surgeons of England, Royal College of Surgeons of Edinburgh, and Certificate of Completion of Specialist Training from the Royal College of Surgeons in England. So I'm the real deal.
Doctor, in what period of your life do you feel the inspiration of becoming a medical doctor specialist?
Yeah, my inspiration for becoming a doctor at all was really by chance. I was lucky. I had a nice childhood. My interaction with doctors was always pleasant, even when they were sticking needles in my arm for inoculations. And they always seemed to be very important people who I could identify with and I could admire, and they were based on science, and I had a naturally scientific mind. So even as a 10-year-old, when we found animals dead on the road, I would take them home and dissect them. I would read anatomy books and start dissecting animals. So I think I was actually born to be a surgeon. I just needed the opportunity.
Doctor, do you have any special stories to share with us?
Yes, I have so many inspirational stories. I'm actually one of the luckiest men alive because I enjoy every minute of my job. I work long hours, but I enjoy every minute of every hour. So, for example, the two most important operations that I'm involved with in my working life, the very common operations of tonsil adenoid removal, which is really simple, but you're just making sure that you do it in the most acceptable and nice way for the patients. And then at the other end of the scale, the more glamorous and exotic surgery involves cochlear implantation. That's mainly doing cochlear implant surgery on babies that are born deaf, and you're hoping to catch them before the 2nd or 3rd year of life, because that's the important time of the life of learning hearing. And you have the opportunity to change somebody's life from complete deafness, where they have a very difficult future, to having normal hearing and develop a normal life. So, for example, I was present at the first cochlear implant operation in the UK, and that was actually for an adult patient. This lady had fairly rapidly lost her hearing completely over a number of years and literally had not heard anything at all for 5 years when my chief, assisted by me, did the first cochlear implant operation. And when you place the device inside, you have to let everything heal up and settle down. And you bring them back 2 or 3 weeks later for what's called the switch on, when you connect the cochlear implant to the power. if you like. And this lady, she was in her 30s, she hadn't heard the voice of her husband or her children for 5 years. And when we switched on the device, she dialed her husband's telephone number, and she was able to hear and understand her husband's voice for the first time in 5 years. And my professor, Ramsden, my boss, myself, the audiologist and the scientists who were involved with switching on the machine, and the patient herself, everybody in the room was crying tears of joy, because it was such a great occasion for development of medicine and surgery in the UK. So, I mean, if that doesn't inspire somebody to do that operation, I don't know what will. And then years later, when I was working in Riyadh in Saudi, I restarted their cochlear implant program in King Faisal Specialist Hospital, where I did about 150 of these operations, but almost all on little kids. And those are a different level of inspiration themselves, because if a child is born deaf, their future is very bleak. Yes, they can survive with family support, but their social life is impaired, their employment prospects are impaired, their romantic prospects are impaired, inevitably. And these children are not rare. And if you're able to catch them before the age of 2 or 3 and do a cochlear implant, you can change a child's life from this very bleak outlook to being completely normal. If you operate on a kid that early, a year later they will be speaking normal, behaving normal, hearing normal. Unless you knew they had a cochlear implant, you would not know there was anything wrong with the kid at all. And when you see those children around the city in the next year or two, and you're out with your wife and you bump into that family and they've got that little kid who's now talking normally, and that entire family want to hug you and thank you for helping their kid, is the best feeling you can have as a doctor. It's better than any money or any fame or success. It's just a great feeling. It's very difficult to replace that feeling.
Doctor, is there any important advice you would like to share?
Well, as an elderly parent who started being a parent at the age of 56, I'm still learning. So I'm definitely not a model parent, that's for sure. In this day and age, people seem to be very concerned, as they should be, with the COVID pandemic. Everybody knows the rules, and in each different country they have a different level of adopting these rules. We're very good at it in the UAE, we're very good at it in the Far East with the mask, which is almost a habit, as it should be. And then other countries that are less good and they pay the price. I don't have any new advice on that. But as the father of a 5 and a 7-year-old, 2 boys, everybody's worried about what's going to happen with the schools. And although there are rare cases of children suffering badly, some very rare complications of the disease in children, those same severe complications actually happen with any viral illness. So there's nothing special about the COVID-19 in that respect. And through collecting data throughout the world, we do know now that children, by and large, do not suffer major symptoms with this condition. And the amazing thing, although they carry huge numbers of viruses in their respiratory system, somehow they're not good at spreading it. For example, in Sweden, where they made no special arrangements with the schools, they stayed open. The children did not appear to suffer. Teachers did not suffer any more frequently than the general population. And the only teachers who did contract the virus, they tracked those infections back to the teachers' homes. So they've not been catching it from the students or the little kids. Now that doesn't mean we should not be super careful, obey all the guidelines and practice safe return to schooling. But the overall anxiety that parents have about the children catching this disease, it's excessive, and I would implore people not to worry that much. What you really want to worry about is young adults catching the disease and giving it to grandma or granddad. That's when the trouble starts. That's my angle on COVID-19.
And lastly, how do you feel in being part of our growing Just Kids Health community?
If it is able to contribute to my area of interest, which is medicine, and if it benefits children who may be needing expensive medical treatment and whose families simply cannot afford it and who are not adequately insured or whose insurers are not prepared to cover such procedures, I just love the concept of anybody raising money, because there cannot be a better cause than providing medical care for children. Everybody needs medical care, but children are our future. Personally, the world could do without me tomorrow, but my children are going to be the future of this world. So that's where we have to really concentrate our efforts. So I admire this development, and I'll do whatever I can to help.
Thank you for watching, and have a wonderful day ahead. Do not forget to comment and subscribe so you don't miss out on our next videos coming soon. Right over there and right over there. Yeah, and put thumbs up. Yeah, this is what I want right now. That helps the channel. But do you like it? Then thumbs up. If you mislike it, then, but you know what I like, thumbs up. And for now on, there's a lot of big thumbs up all around the world from YouTube. People making happiness, but people that are weird, kind of being stuff like Among Us, they put thumbs down. So, ring the bell and subscribe.